According to the National Institutes of Health, anxiety affects about 20% of American adults. Now, Dr. Renee Renardi from Lakeside Center for Behavioral Change, she joins us this morning and has more on anxiety. Good morning, doctor. How's it going?
Good morning. It's going fantastic. How about for yourself?
I am doing very well. And so this is a topic we've been hearing a lot about. I mean, before the pandemic it existed, and I feel like the pandemic just kind of exacerbated this. So how can we go about spotting and treating anxiety?
Well, it's really important to be able to identify and get the appropriate treatment for any medical condition, including anxiety. And as you mentioned, anxiety is so common. About 40 million Americans experience that, 4.4 million children. So it is really good to first be able to identify. And there's lots of ways that we can do that, to look at what are our emotions. Now, we tend to not be very good at identifying our emotions. Anxiety can look like fear, worry, this impending doom, or this feeling of terror, restlessness, tension, panic. There's a lot of ways that anxiety can manifest, all of which that tend to be very difficult to control. When just the standard everyday things aren't working to decrease these emotions, it might be anxiety. You might notice changes in your behavior, avoidance behavior, changes in being able to interact with people, decreased functioning in your relationships at work, other changes in your life. Notice maybe increases in maladaptive coping, where people are increasing their alcohol consumption, feeling more depressed. Physically, people may be having difficulty sleeping. They might notice a decrease in their energy, changes in their appetite, lots of physical manifestations of anxiety. So lots of GI problems, diarrhea, vomiting, constipation, increases in heart rate, sweating, trembling. There's all kinds of physical manifestations that anxiety can have. We also want to take a look at underlying medical conditions. When people have problems with their thyroid or breathing, respiratory problems like COPD, heart disease, there's a lot of physical disorders that people experience that can also create anxiety.
Yeah, and I know when I get super anxious, I have to remind myself to breathe. It seems that my body just like kind of forgets to do that even, and it just kind of tenses up, and you feel it everywhere. But for people who are experiencing this or know someone who is, how can they go about treating this or making it better?
Now, here's the good news. Anxiety is very treatable. The bad news is only about 37% of people receive treatment. So if you're experiencing these things, know that treatment tends to work. First, we always do psychoeducation, learning about your particular type of anxiety that you're experiencing. Psychotherapy, like I mentioned, is highly effective in treating anxiety. We talk about life management skills, but it isn't just coming in and talking about it. There's a lot of skills, like you were mentioning, Jordan, about breathing. We can do relaxation strategies. We can challenge maladaptive thinking patterns. There's a lot of things that we can do. Exposure therapy for phobias and obsessive compulsive disorder. You can also have an evaluation just to make sure there isn't anything medically going on there. So if somebody does have an underlying digestive disorder, IBS or celiac disease or something like that, that might be contributing to their mood, we don't want to miss that. So, and most psychologists will take a look at those things, make appropriate referrals. Sometimes medication can be really helpful. Doing a longer term medication like a SSRI, selective serotonin reuptake inhibitor, or a fast-acting anxiolytic. There's lots of medications. Something that I see and a lot of my patients ask about is alternative medicine. So doing yoga, doing meditation, some of which that has received a little bit of research. We have to be a little careful when it comes to nutraceuticals and taking vitamins and things like that. So if you are doing that natural route, do talk to your doctor about that, especially if you are taking other medications, just because they're not FDA approved, and there can be interaction effects when people are taking natural supplements along with a psychotropic medication.
And I think the biggest hurdle for a lot of people to overcome is to just say, I have anxiety, and know that by saying that there is nothing wrong with you. It does not make you a bad person. It is just something that you can get help with, and people like yourself can help folks who are dealing with that. So how can they get a hold of you, and maybe what would something look like if they came to you and said, you know, I have problems with anxiety?
So if you are experiencing anxiety, know that you're in a great group of other people, right? High functioning folks who are experiencing anxiety, breaking that stigma, coming in and getting help. Because like I said, anxiety is highly treatable. I'm really easy to find. Do a Google search of my name, Lakeside Center for Behavioral Change, Courage Critters. My telephone number is up there, 356-1047. Feel free to give me a call anytime. We start off just by chatting over the phone for a few minutes. If I'm a good fit for you, great. If not, I will refer you to a therapist in your area, and some resources that might be really helpful for you.
Yeah, I think it is good to know that if you suffer from that, you are not alone. I'll just be honest. I have anxiety. I actually take some medications to keep it under control and everything. So, I mean, the biggest hurdle is just for people to know that it's okay. It's okay to say you have it. It doesn't mean that you are broken or that you something is wrong with you in any way. So, Doctor,
Absolutely.
Thank you for having this conversation. Very important one, and I hope people out there get the help if they need it.
Thank you so much.
And coming up on today's show, we are talking about validating emotions. Stick around for that.